Hello, my name is Allison McGrath, and today I am going to be talking about a certain body system that I found to be most interesting in the ones that we have talked about so far. So the system I chose was the muscular system. So first I'll be talking about different medical professions that deal with injuries to this system. So orthopedics, they focus on muscle and bone together, musculoskeletal focus, and they're also known as orthopedic surgeons. They can go into surgery to repair displaced or broken bones, torn muscles, torn ligaments. And then another important medical profession in dealing with injuries to muscles are physical therapists. Oftentimes after these surgeries that orthopedics provide, the patient is then sent to a physical therapist for rehabilitation of that muscle, especially after it's atrophied, if it's been in a cast or been immobile for a while. So the two work hand in hand with each other to rehabilitate muscles that have been injured or have a disorder going on. So one muscle that I'm going to be focusing on specifically for this video are the biceps. So the biceps are lateral to the pectoralis. They are anterior to the triceps, and they are superior to the superior extensor digitorum. So the biceps originate at the coracoid process, which is an attachment of the scapula. And the bicep actually has two heads, a long head and a short head. So both of those heads originate there, and then they form one belly, one muscle belly, which then inserts into the radial tuberosity, which is in the radial bone. So it starts up the coracoid process of the sternum and comes down into the radial tuberosity. So other components of the bicep is the bicep artery that runs along the biceps, and then it's also associated with the brachial plexus, which is a bundle of nerves. So the brachial plexus originates in the C-spine, specifically C5 to C7, and then the nerves run down and they have different attachments in the upper arm. So the functions of the bicep muscle, it has two main functions. One is supination, which is when the palm is up. So when the palm is originally pronated and then it supinates up, that is primarily done by the bicep muscle. And this is done because the bicep muscle inserts to a joint called the proximal radial ulnar joint. So this is the radius, and then this is the ulna, and the bicep attaches at a proximal point here to form a joint which allows for this movement. And then additionally, specifically when the hand is in supination, the biceps will flex, and that is the other main function of the biceps muscle, and this is because the biceps attach to a joint called the humeral ulnar joint. So this is the humerus and this is the ulnar, and they form a joint right here, which is the elbow, and this allows for flexion to occur. So the bicep muscle shortens, and it brings the lower arm up to the upper arm, decreasing that angle between them. So I believe that is all I have for you today. Thank you.